dear students. I am Richa Shakya, Assistant Professor from Noida Institute of Engineering Technology, Pharmacy Institute, Greater Noida. So, today I am here to deliver the lecture. The subject is Pathophysiology and the subject code is BP204T, and this subject comes under the Dr. APJ Abdul Kalam Technical University. So, this is a lecture number 23 and today I am discuss about the jaundice. What is jaundice? So, today in the lecture we discuss about what is jaundice, what is the etiology, what is the causes of the jaundice, and what is the pathophysiology behind the jaundice, and lastly we learn about the what is the treatment of the jaundice. So, basically what is jaundice? Jaundice is the disease of liver, right. So, there is a disease of liver, there is a disease of the whenever the secretion of the bile juices are irregularly. So, now we start with the introductory part of the jaundice. So, jaundice is a condition in which the person skin or eyes goes to the color change. It changes the colors with the normal color to the yellowish, right. The skin color is turns to the pale yellow color, or the eyes, the white sclera part of the eye, which consists of the sclera part which is the white in color. Thus, because of this jaundice, the color will change and it converts like the yellow, it shows the yellow. So, jaundice is a condition in which the skin whites to the eye, the upper skin and the white part of the eyes and the mucous membrane turns to yellow. So, this is because the high level of the bilirubin. Just what is the reason behind the jaundice? There is a bilirubin. There is a reason behind the jaundice, that is a increased amount of bilirubin into the system. So, this occurs the yellowish color bile pigment which will increase, which will not excreted out from the body, it will continuously store into the body, and this shows the yellowish color to the body part, especially in the skin or eye. And this is the whenever the person is suffering from the changing the color from the normal color to the yellowish, then this is a first symptom the person is diagnosed with the jaundice. Now, jaundice is the condition in which the skin tone and white part of the eye and the mucous membrane turns yellow, and it is just because of the high level of the bilirubin, and this is the yellow orange bile pigment, right. So, this jaundice have many causes including the hepatitis, gallstones means there is a gallbladder stones, and there is a tumors into the region of the liver, right. So, there is a many symptoms, there is a many etiologies, there are many causes of the this jaundice. Now, in adults usually the jaundice does not needs to be treated, because the person is whenever ill, the process of the adult is so much good. So, the person do not need to any kind of the special type of treatment. So, jaundice, if we talk about the introductory part, so there is a jaundice is the yellowing of the skin and the white part of the eye, that is known as the sclera, that turns to the yellow, and that happens when the body does not process the bilirubin properly, and this may cause the problem due to the liver. It is a problem in the liver. It is also known as icterus. So, learn this word icterus, right. So, this jaundice is also known as the icterus. Now, bilirubin is the yellow colored waste material that remains in the blood stream after the iron is removed from the blood. So, due to this cause, bilirubin remains stored in the body part, in the blood stream, right, and this bilirubin is the yellowish in color. So, this is a reason behind this jaundice. So, means the bilirubin remains in the bloodstream, so that the person shows the yellowish color to the skin. The liver filters the waste out from the blood. When bilirubin reaches the liver, the other chemicals attach to it, right. So, the substance cause the conjugated bilirubin, means whenever the liver excrete out the waste material. So, what happened at that time, bilirubin reach at there to the liver and other chemicals are attached to the bilirubin continuously, and bilirubin is remain in the bloodstream. So, that's why it is known as a conjugated bilirubin. So, the liver produces the bile, this is a digestive juice, and this conjugated bilirubin enters into the bile and that leaves the body. It is the type of bilirubin that gives the fecus to the brown color. So, that is why it is a reason. What is the reason of the fecal or the stools of the brown color? It is just because of this bile. Just because of bile, the stools will is the brown color. Now, if there is too much bilirubin that is leak out into the surrounding tissues, means if there is a too much high amount of the bilirubin which continuously remains into the bloodstream, they shows some adverse effects, right. So, this condition, whenever the bilirubin remains constant, so not constant, remains into the bloodstream, the term is known as hyperbilirubinemia, right. This term is known as a hyperbilirubinemia, means there is a excess amount of bilirubin in the bloodstream and it causes the yellowish color into the skin and the eye. So, this bilirubin, what is bilirubin? Bilirubin is a yellowish pigment found into the bile and it is a fluid which is made by the liver, and this breaks down the product of hemoglobin from the injured RBCs and other heme containing the proteins. So, this bilirubin breaks the RBCs from the protein, from the globulin or from the protein parts. Now, produced by the reticulo, these RBCs are produced by the reticuloendothelial system and released into the plasma bounded to albumin, and this hepatocyte cells, what they do, these hepatocyte cells conjugate it and excrete through the bile channel into the small intestine. So, this hepatocyte cells, what they do, they just conjugate with the bile juice and they just excrete out towards the small intestine. Now, this is the bilirubin mechanism. So, there is a heme, there is a hemoglobin, right. So, there is a heme protein or globulin proteins. So, there is a heme which goes to the heme oxidase, right, which goes to heme oxidase, which forms the biliverdin, and this biliverdin with the help of biliverdin reductase forms the unconjugated bilirubin, and this process occurs into the liver. Now, this unconjugated bilirubin is now again with the help of UDPGT, that is again form the unconjugated bilirubin, and this occurs into the intestine part, that is a urobilinogen forms the styrocobilin, in the with the help of the intestinal bacteria. So, this is a mechanism, there is a bilirubin mechanism. So, there is a liver and the kidney where the urinary bilirubin will excrete out, right. So, this is a bilirubin mechanism where the heme, there is a heme proteins which goes break down after the injury. They just with the help of heme oxidase, they just forms a bilirubin and they goes to the liver where the unconjugated bilirubin will formed. Then the different kind of chemicals will attach with the this bile juice, they form the unconjugated bilirubin, and this this conjugated bilirubin when goes to the small intestine, they forms the urobilin, and this is at the last form is the stercobilin. This is the metabolism of the bilirubin, how they will metabolize. So now there is a etiology behind the jaundice. What is etiology behind the jaundice? So the acute inflammation of the liver. So in the last lecture we have learned about what is inflammation. So inflammation is the there the inflammation is means there is inflammation, there is a swelling, pain, itching into the particular area, that is inflammation. So there is a inflammation means liver, and the inflammation in the liver is known as a hepatitis. ठीक है, hepatitis. Hepatitis means there is hepato, the word hepato resembles with the liver. ठीक है. So this hepatitis means inflammation in the liver, inflammation of the bile duct, obstruction of the bile duct, due to which there is obstruction of the bile duct, due to which the excess amount of bilirubin will remain in the bloodstream. Now hemolytic anemia, this is a Gilbert syndrome. Cholestasis, cholestasis means there is the stones, there is a renal stones. Now physiological jaundice, maternal fecal blood group incompatibility, breast milk jaundice, and breastfeeding jaundice. So these are the jaundice which is related with the child, which is related with the infants. So these are related with the infants, means when the mother is suffering from the jaundice, and she will feeding the milk to their baby. So just because of that condition, the child is also may cause the jaundice. So acute liver inflammation, I already told you inflammation, there is a inflammation in the liver. So this may impair the ability of the liver to the conjugated and secrete the bilirubin, and resulting the buildup. And this inflammation of the bile duct means this can prevent the secretion of the bile from the removal of the bilirubin, and this cause a jaundice, because whenever the person is high bilirubin, that is a hyperbilirubinemia, right. So there is a this is a main cause of the jaundice. Obstruction of the bile duct means this prevent the liver from the disposing of the bilirubin. Hemolytic anemia, what is hemolytic anemia? Means this is the production of the bilirubin which increases the whenever the large quantities of the red blood cells are broken down. Means hemolytic means there is a rupture, there is a breakdown of the RBCs, right. Now second one is a Gilbert syndrome. So this hemolytic anemia is also known as Gilbert syndrome. This is the inherited condition that impairs the ability of the enzyme that process the excretion of the bile. And next one is a cholestasis. So cholestasis is this interrupt the flow of the bile from the liver, just because of this containing the conjugated bilirubin remains in the liver instead of the excretion. Means it will just because of cholestasis, the bile will not remove from the body, it will remain into the blood stream. Types of jaundice. So there are the different types of jaundice. There are 3 types of jaundice. There is a prehepatic, hepatic, and the posthepatic. There are 3 types of jaundice. That is a prehepatic means before the liver, in the liver, and after the liver. This is the main concept behind the types of jaundice. Now if we talk about the prehepatic jaundice, so prehepatic jaundice is the condition in which the heighten of the blood rate of hemolysis, and this is the process through which the red blood cells are broken down, releasing the hemoglobin and convert into the bilirubin. Means The first is a prehepatic, means whenever the cells are, whenever the RBCs are ruptured due to any kind of injury, they can broken down. They can broken down. The rate of hemolysis will increase. As the rate of hemolysis will increase, the process of the converting of hemoglobin is into the bilirubin is also high. This is before the liver. It is a condition in the prehepatic liver, prehepatic jaundice. So, because the liver can only process so much bilirubin, so at once bilirubin overflow into the body tissues, means whenever the RBCs are broken down rapidly, so those just go to the liver, and now there are some symptoms, there are symptoms of the prehepatic jaundice, which includes the abdominal pain, fever including the chills and the cold sweat, abnormal blood loss, and feeling itchy. There is some itchiness, there is some uncomfortable with the skin, dark urine or the pale stool. The dark urine or pale stool is the some major sign of the jaundice. Now, diagnosis of the prehepatic jaundice. So, first is a urinalysis. What is diagnosis? Diagnosis means to identify. So, urinalysis means to measure the amount of certain substances into the urine, and this is the first diagnosis which is used for the diagnosis of prehepatic jaundice, urinalysis. Now, blood tests such as the complete CBC test, as a complete blood count, or the liver function test LFT, to measure the bilirubin and the other substance into the blood. So, this CBC and LFTs are done for the lab to check the level of the bilirubin or the other content into the blood stream. Now, imaging tests. So, there are some MRI, CT scan, ultrasounds or X-rays are performed. So, such as MRI ultrasounds are examined to the liver, gallbladder and bile ducts to rule out the other form of the jaundice. Now, HID scan to help the finding of the blockage and other tissues into the gallbladder, bile duct and the small intestine. So, this HIDA scan is used for the diagnosis. Now, next is the hepatic jaundice, means it is in the liver. It is prehepatic is before the liver, and then now it is occurs in the liver. So, that is a hepatic jaundice, and this hepatic jaundice occurs when the liver tissues is scarred, means there is this scarring of the liver is known as the cirrhosis, right. So, this damage, this hepatic jaundice occurs the damage of the liver tissue which cause the cirrhosis and dysfunctioning of the liver, and this makes it less effective at filtering out the bilirubin from the blood, right. Now, since it can't filter into the digestive system, for the removal the bilirubin will build up in the high level into the blood stream, because the bilirubin will can't excrete out from the body. Now, causes of the hepatic jaundice, that is liver cirrhosis. As I told you, liver cirrhosis, there is a damage of the liver cells. Now, viral hepatitis, so there is an inflammation of the liver which cause the several kind of viruses. There is a several kind of attack of the viruses into the condition of weak liver. Primary biliary cirrhosis, that is which help when the bile ducts are damaged and can't process the bile, and this will remain into the blood stream. Alcoholic hepatitis means the person is taking high much of alcohol intake, and this is called the damage of the liver. So, this alcoholic hepatitis, which liver tissues are scarred with the heavy or the long term using the intake of the alcohol. Now, next is a leptospirosis, which means it is a bacterial inflammation that occurs the infection into the animal's urine or feces. liver cancer, when the person is suffering from the prolonged or the chronic chronic hepatitis or liver cirrhosis, the person may cause the liver cancer, and which it means which cancer cells are developed and multiply within the liver tissues, and this is just because of the continuously liver cirrhosis or the liver or the hepatitis condition. Now, symptoms of the hepatic jaundice. So, this hepatic jaundice includes the loss of appetite, skin itching, weakness, abnormal blood loss, swelling of the arms or swelling of the abdominal legs or the lower part of the abdomen, dark urine in the pale stool, pain in the muscle or joints, darkening of the skin, and the fever. Fever is the main cause of the inflammation. Now, diagnostic, as I told you, the diagnosis is just like urinalysis. The urine content is taken and the sampling will done. Blood test, so CBC and LFT again CBC LFT will done for the checking the condition of the liver or the complete blood count. Imaging test, MRI, CT scans, or again HIDA, ठीक है, HIDA test will be done for the scanning of the organs. Last one is endoscopy. Endoscopy is again done for the checking of the this hepatic jaundice. Now, last one is the post hepatic. So, post hepatic means after the liver. So, the post hepatic, or this is known as the obstructive jaundice, which happens when the bilirubin can't drain properly into the bile duct or digestive tract just because of the blockage. So, the most common symptoms of the post hepatic jaundice are gallstones, means there is a gallbladder stones due to which the bile juices are not the bilirubin will not drain out properly. Pancreatic cancer, there is a cancers of the pancreas. Now, bile duct cancer, pancreatitis. Pancreatitis means there is inflammation into the pancreas. And last one, the biliary atresia. What is biliary atresia? Biliary atresia is a genetic condition in which the person have a narrow or missing bile ducts. So, this is a condition of the biliary atresia, means whenever the person have missing their bile ducts, so there is a no bile duct, so there is a no removal of the bilirubin. So, symptoms of the post hepatic jaundice, the symptoms of the post hepatic jaundice are dark urine or pale stool, abdominal pain, diarrhea, abnormal blood loss, skin comes to itchy, abnormal swelling into the body part, that is abdominal or the lower part of the abdominal part of swelling, leg swelling, and fever. Now, symptoms that cause the jaundice and the metabolism of the bilirubin. So, there are the three: pre-jaundice, which may cause the malaria, sickle cell anemia, intrahepatic or the hepatic jaundice, which is caused the viral infection, alcoholic liver disease or liver cancer, and post hepatic is just because of gallstone, bile duct cancer or pancreatic cancer. So, these are the conditions, and this will all cause a jaundice, and this jaundice metabolize the breakdown of RBCs, hemoglobin, and this increases the bilirubin, and whenever the bilirubin is high in the blood stream, so this is cause the yellow pigmentation of the skin. Now, there are some diagnoses. I already told you what are diagnoses behind the jaundice. There is a bilirubin test. So, bilirubin test is into the CBC, right. So, this is the LFT test or the CBC test for the diagnosis of the jaundice. So, these are the some there are some diagnoses of the jaundice, that how the jaundice will diagnose. So, this is all about the topic jaundice. Thank you.